And for more on these vaccine trials and what they could mean for the ongoing fight against Ebola, I spoke to Dr. Arthur Caplan. He's the medical ethics director at NYU's Lagone Medical Center.
I'm optimistic. I think it's appropriate to try some of these drugs, some of these new vaccines out. What I'm a little nervous about is that we shouldn't give up on or cut back on the public health measures. Isolation, hand washing, proper disposal of dead bodies are still key to controlling the epidemic. That's the core. Whether we get some help from these drugs, we'll see.
How do you successfully test vaccines in a region where there is already distrust of foreign health workers? Do you think there will be any issues getting patients to participate, or is the situation so dire, has it been so dire, that these people will try anything?
You know, given the death rate from Ebola in these West African countries, I think people will try the vaccines, and you certainly have groups of people, doctors and nurses, who care for people with Ebola, people who dispose of the dead bodies. These are folks who are at extra risk. I think that's likely to be your vaccine testing population. The bad news is, even if we got some good results from these vaccines, it will still take months, if not a year, to make a large amount of the vaccine. So vaccines probably aren't going to be useful in this epidemic, better for the next epidemic.
And you mentioned the testing on different groups of people. You know, we're testing on some of the most vulnerable people here. If there wasn't an outbreak in countries like Liberia, Sierra Leone, how would the testing take place? How would it be conducted? Because we're really looking at these very poor countries here.
Well, you know, I'm a member of the World Health Organization Ebola Ethics Committee, and we thought about, you know, the need to say that it was ethical to do these studies. Obviously, there's a grim and sad history of exploiting people in Africa for studies. People have not been well treated, but when you have an outbreak and when it really spreads out of control, trying drugs makes sense, particularly when you have a safety profile. What's being tried are drugs that already are around. They basically attack viruses. Ebola is a virus. And so what we're doing is taking drugs that have some safety record and saying, let's try it against Ebola. I think once that's understood, it becomes a little less likely to be a situation where people worry about exploitation.
What vaccine stands out to you at the moment? What should we look for? And what do you see happening in the next months, in the next year or so?
I think what you'll see is these drugs are not going to be tested in the standard way. What we'll probably see is what are called cluster trials. One hospital gets drug A, one hospital gets drug B, one hospital gets drug C, and we'll see which one does better. That's not the usual way to test with a placebo, but I don't think placebo trials make sense given the lethality rate, the large number of deaths, the high risk of getting this if you're a doctor or working around disposing dead bodies. So let's see if we can get a marked improvement in survival from one of the drugs over the next few months. The other big issue is if we get improvement with the drugs, we're going to have to pay for them. There's going to have to be a discussion about what the international community is going to do to help subsidize the cost. These are very, very poor countries. Even if you have something that works, there's got to be agreement to help subsidize the cost.